Hello everyone, I am Erica Navarro from 11D Group 15. In today's video, I will be performing a return demonstration on how to assess or assessing the abdomen. So abdomen is what we commonly call a belly. So this is between the thorax and the pelvis. So why is it important to assess the abdomen? It is to ensure the client or determine the client's health problems earlier and prevent further complaints developing the existing disease. Example for that is spleen. Enlargement of spleen will not cause any symptoms. So by assessing the abdomen, we will be able to know if the spleen is in normal size or double its size. So before we proceed in our return demonstration, I will show to you what are the equipments that we will be needing during the assessment. So first, we will be having a stethoscope. This stethoscope will be used during the auscultation. This is to use to hear such as a venous hum or friction rub. Next is a centimeter ruler and a marker. These two things will be used during if we will able to notice a distension from the liver of our client. Next is the pen light. This pen light is used during the inspection of our client if we will be able to notice any lesions or scars that are not yet healed. Next is our second hand watch. This is used during the auscultation. And lastly, the small pillow. This small pillow is used during the positioning of our client. This is to ensure, this is to put underneath the knees of our clients to ensure that the muscle of the abdomen will be relaxed so that there is no uncomfortable feeling during the assessment. First, we need to review the doctor's order to know what is the assessment that need to be done to our patient. Next is prepare equipments, but I already showed to you, so it is already prepared. And lastly is do hand washing to avoid the cross microorganism from patient to nurse and nurse to patient. Good afternoon, sir. Ako tayo si Erica Navarro. Ako ang nurse, student nurse for today, sir. Pwede mabala niyo mga pangalan, sir?
Ako tayo si Jaylord Camarillo.
Okay, so, kamusta mo ka today, sir?
Okay lang man, no?
So, unsa man ang imong complaint for today, sir?
Nagasakit mo nung tiyan, ma'am. Kung man ako kaon gabi, tapos nabalaka ko ba kayang karon pag mata ko sakit ng gihapon.
Okay, so sa ato, i-check up karon, sir. So, okay lang ba kung i-close na ko ang door?
Okay lang, ma'am.
Okay, so, para ma-aware ka, sir, ang ato ang assessment karon kay ikaw, ako nga nurse, and ang possible na doctor nimo ang makabalo lang sa inyong mga results. And sa karon na assessment kay naay parts ay maski na ma-expose, but ayaw ka bala ka kay kato lang na part dili na ta mobiyan ato. And another, sir, is pag naa kay mga complaint or mga questions, ayaw ka hesitate mag-raise ay mga questions. Okay lang ito, sir?
Okay lang.
Wala na kailangan mga pangutan na, sir?
Wala.
Okay, so mag-start na ta. Preparing and positioning the client. Ask the client to void or full bladder. This is to ensure and this is to avoid a uncomfortable feeling during the assessment. Next is ask the client to in a supine position and flex the knees slightly and put a small pillow underneath the knees. This is to make sure that the muscle in the abdomen will be relaxed. And lastly is ask the client to put his or the gown covered only the upper part and the lower part just in a xiphoid process just above the symphysis pubis. This is to ensure the full visualization of the abdomen. So, sir, okay lang, sir, na-ilisan ng paglabgan ni mga sanina, sir.
Okay lang, ma'am.
Sir. Okay, sir, so magida na to, sir.
Hindi lang kami ka.
Dali, sir, yung ulo. So, i-flex na pag may matikil, sir. Ano to? Feel. Okay. So, imong kamot, sir, butang na to. Dali. Tapos, ako lang i-fold pataas, sir, ha? Inspecting the abdomen of the client. This includes the skin characteristics, the symmetry, the contour, the abdominal girth, and the abdominal movements. This step is a key step to evaluate a abdominal complaint such as pain, distension, enlarge of the organs, and masses. So the first we will look at the client is the skin characteristics. So sir, okay lang ako ang tanawan sir ha?
Okay, ma'am.
Sir, naalagay ni scar sir. Para sa asa nigikan ni scar sir? Dugay na ni siya?
Wala na siya stretch mark katong pagsugod sa quarantine.
Okay sir. Okay. Okay sir, okay lang ba kung i-flex ni mo forward gamay mong head?
Okay, ma'am.
Na ba kayo ma-feel na pain sir?
Wala man, no?
Wala, sige balik. Okay. So, i-check na ko ang contour sa inyong hagtiyan, sir, ha?
Okay, ma'am.
And then, ang symmetry, kung ano ba siya, dili ba siya symmetry or asymmetry. Ang asymmetry, sir, kay dili na siya normal. Like, na ay nag-bulge siya pikas, tapos ang isa kay dili bulge. Okay. So, karon i-check na ko ang imuhang abdominal girth or ang katako sa imuhang abdomen. Okay, sir. Relax lang pa, sir, ha? Okay, sir, it's 102 cm po. Okay lang, sir, kung mo ginhawa na kagbalik, i-check lang nato ang abdomen na respiratory, sir. Inhale, ginhawa lang dyan. Okay, sir, wala namang pong problema. Present naman po ang abdominal respiratory. Nag-expand po siya. And ang iyang pulsation and ang iyang peristalsis. Auscultating the abdomen. So, auscultating the abdomen is to detect or altered bowel sounds such as rubs or vascular bruits. So, starting with the bowel sounds, ask the client when was the last intake. It is because the peristaltic activities. Next is warm the hands and the diaphragm. This is to avoid of startled of the clients because of the coldness. So sir, okay lang ba kung matouch na kung imuhang abdomen karon?
Okay lang.
When was imuhang sir? Kano sa imong last na kaon ka?
Buntag, ma'am. Nag-on ko buntag. Wala na ko nag-
Parang lunch wala na.
Wala.
Mag-ask lang ko sir. Asa ganito dapit ang sakit sa imuhang nabati sir?
Dali, banda, no?
Diri dapit. Okay. Sige. Relax lang ka sir ha. So, in checking the vascular sounds, we will be using a bell because the sound of the bruits in the venous hum are low pitch. So, we will be checking the aorta, the renal, the femoral, and the iliac, and also the umbilical and the epigastric. So, sir, mag-start na po kami ha, sir, ha? Relax lang ka, sir.
Okay, ma'am.
Okay, sir. Thank you. Checking the peritoneal friction rub. This time, we will be using a diaphragm because the sound of the friction rub is high pitch. So, sir, mag-checks pa, sir, ha?
Okay, ma'am. Check.
Relax lang, sir. Okay, sir. So now we will proceed in percussing the abdomen of our client. So in percussing the abdomen of our client, this is to detect of any tenderness or masses of the abdomen. So in percussing the abdomen of our client, this includes the liver, the abdomen tone, the kidney punch, the test for ascites, the abdominal aorta, and the spleen. So in doing the abdomen percussion, we will be using a systemic pattern. I am using a Couchier systemic pattern. So now let's start percussing at the abdomen of our client. So in abdomen tone, we will need to hear the tympani and dullness of the areas, of these such areas in the abdomen. So we will be using a 4 quadrants in here, and we will start our systemic pattern using a Couchier. So sir, magkuan ako sir, magpercuss ako sir ha, kanang relax
Okay.
lang. Okay, sir. Thank you. After percussing the abdomen tone, the tympani and dullness are well heard in the areas in the four quadrants. So assessing the liver span at the midclavicular and midsternal. This is to assess of the liver size and assess for hepatomegaly. Hepatomegaly is known as enlargement of the liver. So we will start in the midclavicular line, starting from the right lower quadrant up to the right upper quadrant. And when the dullness is heard, mark and then proceed to right upper quadrant and down to right lower quadrant. When the dullness is heard again, mark and then measure the liver. Same with the mid-sternal line. So now we will start. So sir, sa karon akong buhaton sir, magmarka ko sa imuhang tiyan. Okay lang ba na sir?
Okay lang.
Okay, so mag-start na ko sir ha?
Okay.
Gamay na, as na o gamay sir ha?
Okay.
Kamo mag-start na po ko diri sa tunga sir ha?
Okay.
Relax lang. Okay. Karon ako asa siyang i-measure. Eight centimeter, and the other one is 6. Okay, sir, thank you. Now, in liver descent. So, in liver descent, this is to know the hepatic enlargement and the displacement. So, we will now ask the client to inhale, and after inhaling, we need inhale, hold it for a while, and then start percussing, and then after start percussing, if the dullness is heard, then mark it, and then after mark, ask the client to exhale, and then measure the from that point down to the right costal margin. Mag-start na ko sir ha.
Okay.
Kana mo inhale ka and then hold up for a while, okay?
Okay.
Inhale. Hold po for a while. Exhale. Measure ko lang po, sir, ha?
Okay.
Dali lang. Twice. 10 centimeter po. Okay, thank you, sir. So now we will start assessing for spleen or assess for splenomegaly. splenomegaly. So splenomegaly is, this is to know if there is any enlargement of the spleen of our client. So in starting the assessment, ask the client to do a side lying position and make sure that the right leg of the client is straight and the left is flexed. So sir, okay lang ba kung diri ka mo atubang sir sa right?
Okay.
Okay, straight lang ng isa sir. Then ang isa kay naka-pillow. Now we will look for the left anterior chest wall. And then we will start percussing. And make sure that you will hear any tympani, because if you will hear a tympani, it means there is no enlargement of the spleen. So while percussing the spleen of the client, there is the tympani is well heard, and that means that the spleen, the splenomegaly is not present. So the tympani is considered normal. So now we will look for the spleen percussion as sign, and we will look at the lowest anterior chest wall. Sir, okay lang mo inhale, exhale ka sir, pero i-hold lang for a while. Inhale.
Okay.
Hold for a while. Exhale. Okay sir, thank you. So, assessing the liver blunt percussion, this is to evaluate or to detect any tenderness of the client's liver or if it is hard to palpate. And after doing the liver blunt percussion, ask the client for any pain. So, sir, mag-start na ko, sir, ha?
Okay.
So, pangitaas na ako. I will find the rib cage of the client. Ini lang ko sir ha, if naa kay ma-feel na pain. Paghuman na ako og strike sir. Na kay na-feel na pain sir?
Wala man.
Okay. Assessing for kidney punch. In kidney punch, we will able to know if there is kidney tenderness. And this time, the client will be in a sitting position. So sir, relax lang sir ha, and lingkod lang tagtarong. So using my hand, or using my left hand, I will place it in the 12th rib, and then using my fist, palmar hand of my fist, I will strike only one at the kidney to detect if there is any tenderness. Okay, thank you, sir. Test for ascites. This is to detect for any ascites from our client. Our first test is the shifting dullness. So while the client in supine position, start percussing from the left from the client to mid-sternal. So sir, mag-start kog percuss sir ha. Next is ask the client to side lying position. This is to indicate if the dullness will change into tympani. Okay, sir, thank you. Fluid wave test, this is test also for ascites. And the positive in this test, if the wave of the client or the fluid will transfer to the other side, it means that it is positive. And as for client for assistance, this is to make sure that the test is to know if it is negative or positive in the fluid wave test. So if the fluid will transfer to the other side, that means that the client has a ascites or positive in the fluid test. So sir, okay lang sir kung gaano ka mong kamot, ibutang lang ako dari ah.
Okay.
Okay. Okay, relax lang sir ha. 2, 3. Okay sir, thank you.